She wasn't educated enough to know that there were risks with this patient's skin type.
Yeah, it's heartbreaking.
Fitzpatrick is a scale that we use in the industry, and it's based on skin color, skin type.
You can have devices that are approved for a certain skin type, and if the settings are incorrect, then you may have this adverse result.
And she was like, "Are you comfortable treating somebody that looks like me?" And it really makes you stop and think, because
it took us a minute to get it, but yeah, and thank you, Sierra.
Us. I mean, it's how I think it's how we live our life.
Hi, and welcome to Beauty and the Brain, the podcast where we discuss all things aesthetics. I'm your co-host, Dr. Chris Croley.
And I'm Jerry Drinkard, family nurse practitioner. And together, Chris and I own Skin Tonic Med Spa that's located in Pace, Florida. We're joined today by Allie Blue, who is a nurse practitioner that works with us at the clinic. And we're so happy to have you.
Glad to be back.
Allie, for you guys, you all know she's one of our regulars. We love her. She's been at the clinic now for a few years with us, and really happy to have her join us today for a topic that is really something that I don't think is focused on enough. And this is, the title is treating skin of color, and I don't think people really know exactly what that means. And so we're going to talk about that a lot today and how that applies to different device treatments, laser treatments, chemical peels, and how we have to vary these things. So I just want to start, maybe Jerry, you can talk a little bit about a Fitzpatrick scoring system. And so that's a scoring system that we use really to classify patients when they come into the clinic.
Fitzpatrick is a scale that we use in the industry, and it's based on skin color, skin type, and with a pale redhead being a Fitzpatrick 1, and it goes right on up with, the higher the number, the darker the skin. And so once we start getting into the Fitzpatrick 3s, 4s, and 5s, then we really have to focus on treating those patients a lot differently than we would a 1 or 2. I know when I first started in the aesthetics, this has been 15 years ago, that I didn't realize that. Like, I was just under the impression, I thought like darker skin was even tough, maybe, that you could treat it more aggressively than you could other skin types. And it's quite the opposite, actually.
Yeah. So, I mean, I don't know that I also fully appreciated that when we first started our aesthetic career. And so, again, just, to put it in perspective, if we looked at, it's not just your skin color, but it's your response to sun, how easily you tan, how easily you freckle. And typically the lighter you are, the more easily you burn, the lighter color eyes, lighter color hair, the less likely you are to scar. And so when we look at this scoring system, I don't think a lot of people realize it, but even myself, I would be scored as a Fitzpatrick 3. Mm-hmm. So even though I'm Caucasian descent, I would still be a 3. And in fact, with some of the device treatments in the past, have had pigment problems. So Allie, do you assess a Fitzpatrick on everybody that comes in?
Every single person that comes into the office gets a Fitzpatrick scoring on their intake paperwork. And I want to mention, something, it's even in our intake paperwork. It's a class that we went to recently in Dallas. I went to a presentation about treating skin of color. And it really opened my mind up because, you talk about burning and thinking, oh, it's safe, because on the Fitzpatrick scale, the wording that's used is a Fitzpatrick 6, which is the darkest skin type, says never burns. And that's not true. A Fitzpatrick 6 can stay out in the sun long enough to burn, even though you may not visibly see a reddening of the skin because of the pigment and the melanin in the skin, they're burning their skin. And so I think that's another big thing to where, I even, doing the intake paperwork when I first started, never burns. I just was like, okay, well then that's going to be safer for me to treat with heat products, laser products, whatever. And that's, I think, where a lot of people get kind of confused.
And another thing when we ask these questions and talk about these treatments that I think, people are really pretty good now about sunscreen, sun protection. And so the other thing that we assess when they come in is also their ethnic background, right? Because we could have someone of an Asian descent, but they may be really light skin because they have actually taken really great care of sun protection and they stay out of the sun and wear sunscreen. But when you treat those, do you still treat them like the skin color they are, or like their ethnic background would
They're
predict?
still scored at a 4, the Fitzpatrick 4 for me. So ethnic background, ethnic origin is very important in treating all of these patients. So, sometimes it can be an awkward question to ask, but it's very upfront, and you want to make sure, if you're a provider listening, that your clients know that you're taking their safety first and foremost, and that you're not taking for granted their ethnic origin and could potentially harm their skin because you're treating them too aggressively.
I think it's important questions. We have like a family that are Brazilian, and we treat literally there are 5 of them that come in, and they're all different skin type or different skin tones. But they all obviously they're full siblings, have same ethnicity. But if you just took one of the siblings and isolated her, like she appears a lighter skin tone than I do, where the brother appears like a Fitz 4 or 5. And so I think that those questions are extremely important, and I think it makes our patients really appreciate that we're going that extra mile for their protection.
Yeah, and I think, kind of to drive the importance of this home, one of the most significant pigment issues I've had to personally deal with after treatment was on one of my really good friends. She's one of my best friends actually for many, many years. And Mira, if you're listening, this is a shout out to you about your personal story. But we all try when we have people, friends, family that may travel, or patients even, that travel to see us from a distance. We try to pack as much as we can into a treatment because we know they're not close by and we may not get to see them a lot, and we want to do something nice. And so Mira is just naturally beautiful, but she's of Korean descent, great takes great care of her skin and uses a lot of sun protection. But I wanted to do something nice, and we were going to do an IPL for her. She really probably didn't even need it. She had a little bit of pigment stuff. I was like, oh, you'll do great. Let's just do it while you're here. And we were a little more aggressive with it than I normally would have been because she was visiting. And, unfortunately, she ended up with some hyperpigmentation kind of up in her forehead around the hairline that did get better over time. And fortunately, she was one of my best friends. And so she was, incredibly gracious and kind as we went through that process, and the pigment did resolve. But it was really a big lesson to me. This is before we had some of the newer devices we have now that are safe for all skin types. This was one of our original devices, and it really drove that point home of how careful we have to be with people that are prone to be a darker skin type.
So speaking of horror stories real quick, I did want to show you guys this video of this poor girl on TikTok. And we'll clip the video for you guys.
Hey everyone, look at my face. It's devastating, right? I want to inform everyone about the risk of a BBL broadband laser facial. I recently went in to see my esthetician and was told that this would be perfect for my skin. No risk, no scarring, no downtime, just a little bit of swelling. Unfortunately, after my service, I went into shock, had to be sent to the ER, and now have 1st and 2nd degree burns. This service is not for melanated skin, not for pigmented skin, and at this point, shouldn't even be offered to people with brown skin. Once again, please people, look at the risk. Don't allow them to tell you it's for our skin, or that it won't leave scarring, or that it's gonna be okay. I had to go to the emergency room, and my body went into shock. I could have died on the table over a facial. I am traumatized about this whole situation. And I pray that this gets out there to someone out there, that they check the, Google it, look up the risk.
So they showed her photo as an example in the class that we went to in Dallas. And one of the presenters actually does have contact with her, and she's still hypopigmented to this day.
Yeah, hypopigmentation, once the pigment is gone, is much more difficult to treat than hyperpigmentation if it gets dark, and we just need to lighten it. And so, yeah, that's an awful horror story. It's heartbreaking. For sure. She mentioned Google, so we all have this information at our fingertips. It sounds like she asked her provider, so unfortunately that provider, told her it was approved. So you can have devices that are approved for a certain skin type, and if the settings are incorrect, then you may have this adverse result. We know that for some of our devices, for our Fitzpatrick 4, 5, and 6, we have to really dial down the settings.
Right.
And so although the device is approved, we could misuse the device and have a bad result.
That's kind of what I feel like happened with this one. She felt confident in saying what she said, and maybe she thought she was being honest with her patient, but she wasn't educated enough to know that there were risks with this patient's skin type.
Yeah, and you guys also feel free to go watch us over on YouTube. You'll get to see that entire video. It's posted on our YouTube channel. In addition to that, at the end of this, I'll also share one of my laser treatments where I had a significant burn. This was not at our practice. I actually decided to go and get a treatment somewhere, and that was where the machine was approved for my skin type, but the settings were probably not correct. And I did have pigment issues. Fortunately, we have other things, and I've been able to, recover from mine over time. But it's a really good example of what can go wrong with lasers. So not only do you want to know about the device that they're treating you with, what it's approved for, but also that provider's experience with treating any kind of skin with pigment, skin of color. Don't be afraid to ask those questions. And if they're, it's nothing wrong if they're not educated in that area, but maybe find another provider. Or know what training that provider is going to get before they perform the treatment on you. Thanks for sharing that.
Yeah.
So Allie, what did you really, why don't you talk to us some about this class you took in Dallas and tell us some of the big high points of that?
So some big high points of that were, treatments that are safe, and then treatments that you have to be very, very careful with. Low and slow is the way to go with any Fitzpatrick 4 through 6. There are some treatments that just aren't safe to do on those higher Fitzpatricks. Like I would probably never do an IPL on a 5 or a 6, which thankfully we have our Indiag laser. The Aerolase Neo is safe for all skin types, which we use similarly to what you would use IPL for. But it was heartbreaking in that class. Like me and Sierra were sitting there together, and I had like tears welling up in my eyes at the permanent damage that can be done to people with darker skin tones. And so it makes me, scared for them that you don't vet providers and that somebody is going to damage their skin to the point where you can't fix it. You can fix a lot of things, but there have been some horror stories, and I think it's very important as providers for us to educate ourselves so that, or if you don't feel comfortable treating a client of that Fitzpatrick because of your lack of training or education, refer out. Refer to somebody that has experience with that patient population, has the education on that patient population, has devices that are safe for that patient population. Don't treat somebody with an IPL because they request it, even though it's not really safe for that skin type. Refer out to somebody who has a different type of device that is safe for skin types. So I think that was a big takeaway, how to talk to people about, their sun protection too, and then, some protocols that may differ between lighter skin tones and darker skin tones. So for example, something that we like to use to treat with like melasma or hyperpigmentations of the skin is like a hydroquinone cream. And so, you never want to go above a 4% with the hydroquinone cream, which is a cream that helps to block melanocytes and can help to lighten the appearance of dark spots on the face or anywhere. When you have them on that, usually we say for lighter skin tones, you can do 3 months on, 3 months off. Well, for darker skin tones, they really stress the importance of having a 6-month break between periods of using that medication on the face. So those are some big ones
Jerry,
for me.
Allie mentioned that using a device that's approved for those areas. So why don't you, if you don't mind, elaborate a little bit about the devices and how we choose which ones to bring into our practice?
Yeah, well, I think when we're talking about changing and scarring patients, that we have to not only take into consideration hyperpigmentation, but hypopigmentation, and especially in this population. And a lot of people don't even know about that. And so carefully choosing your device, the way that you're treating it, you're spot on is about going slow and going low. With all of my patients, I have a pretty big Peruvian population that comes in. We do a lot of test spots. We test behind the ear with some of these lasers. We do the same thing with chemical peels. And so, and then some of the patients, like you said, they're just not candidates for it. So we use the Airlace Neo, which we've loved for years in our practice, and it's phenomenal laser. It's safe for most skin types for treatment of an array of things. Another treatment that's very safe that we use a lot is the VI peel. It's a combination chemical peel. And so we do those things for patients. We start them on, good cosmeceuticals that can help to alleviate some of the problems. And so I think that your proper assessment, education, and letting these patients know that most of the time it's going to be a process and they just have to trust you through it.
Yeah, I mean, I think that's true. And then again, on the devices that we choose, we try to make sure that we get devices that are approved for all skin types, even lighter skin types that are getting a lot of sun exposure. We live in Florida on the coast, so it's really important that we can use them year round. But more importantly than that, we know that there are safety protocols and ways that we can use devices in a safer manner on all skin types. So we train extensively on that. So I certainly don't, I feel a little bit bad saying this, but I know Allie knows me well, so she'll take it the right way. But I don't mean it to sound like fatherly in any way. She's a professional and independent in her own right, but I'm really proud to see how she has developed her career and her training in aesthetics. She's really taken an interest in some of these energy-based devices and educated herself. And it's really nice to see her grow in that. And so, like I said, I don't mean to sound like a father figure when I do that, but I'm really proud to see that because—
We'll call you daddy.
No, don't call me daddy. No. But it is.
This is another episode of Call Chris Daddy.
That's another episode. But you really have, and so it's nice to see because these are things that we learned. We took classes on, but we also learned a little bit from the School of Hard Knocks. We had some problems along the way. 13 years ago, we had a CO2 laser, and we had to deal with a variety of complications with that device. And so we've been smarter about the devices that we bring into the practice. We've been better about training. We have had a few complications here and there. Like if you do enough procedures, you're going to have it. But we've got much better at dealing with them. And like I said, I really feel that we have an asset by having somebody in the practice that really understands these devices besides just the two of us. So we know that, if we're not around or we leave, that the patients are well taken care of. So in addition to the laser devices, what are the things that we really can offer to all of our patients in the practice? Not just our lighter skin type patients.
Yeah, so a lot of treatments are safe for all skin types. That's going to be really any injectable that we do, certainly any of our facials that our lovely esthetician provides. Even like Jerry was saying earlier, the VI peel can yield very good results, even for some of those pigmentation issues. Airlace Neo laser, as we've harped on, is safe for every skin type. In laser hair removal, and like Jerry was saying earlier, we can do some test spot treatments, in very concealable areas to make sure, that nothing's too high and isn't going to hypopigment.
One of the things that we haven't really touched on, and especially in the these Fitz 3s through 6s, is keloid risk. That is something to take into consideration, and we've seen. Fortunately, we haven't had any of these problems, but we've seen the aftermath of some of these chemical peels over the years that have just caused tremendous amounts of scarring. And so you just have to take all of that into consideration when you're treating, because they come through our door to be better. And the last thing we ever want to do is to send them out worse than they came in. And so, I think that education. We're seeing one of the most educated population of patients that we've ever seen, because so many people go to like these social media platforms for their, recommendations or reviews or whatever of different products. And so it's really nice to have patients come in now and they'll actually ask you, is this going to be safe for my skin type? And we never saw that, even 10 years ago, patients didn't ask us that.
I was planning to take the class, but one of the things that inspired me to make sure that I was there when the doors open for that class was one of my patients. She came in actually for a sexual health procedure, and she asked me, we were talking about other treatments available at the practice as well during the consultation and everything, and she was like, "Are you comfortable treating somebody that looks like me?" And it really makes you stop and think, because we do treat, like you were saying, a wide variety of Fitzpatrick scores, ethnicities, people from different backgrounds and cultures. But to be quite honest, we don't treat a heavy population of Fitzpatrick 6s. And that really made me want to educate myself more and do more for my clients, because I want to be the best that I can be and know that I can 100% say, yes, this is safe, or no, this is not safe, or we're going to do a test spot, or what we need to do in the process to make sure that she feels good about me and I feel good about treating her and giving her the best result, and most importantly, a safe result that's not going to leave her with a scar for the rest of her life, or a hyperpigmentation or a keloid, or something that, God forbid, we couldn't fix. Mm-hmm. Which I think post-inflammatory hyperpigmentation is something that we may need to touch on, if either of you want to talk about that. Or you'll hear a lot of people call it PIH, and I think it's something that gets thrown around a lot, but that clients don't know exactly what that is, or who's at risk for it, or what it means, or is it treatable?
Talking about PIH, it's a school of thought. Dr. Davin Lim in Australia, he feels like when you treat some of these Fitzpatricks aggressively, that's just part of the healing process, is the post-inflammatory hyperpigmentation. So that's where our as far as us being clinicians comes into play, to educate our patients and then to keep that post-inflammatory hyperpigmentation down as much as we can during the healing process. But I do think that when patients are prepared ahead of time and they know that that's part of it, then the level of comfort afterwards and the comfort in the care that they're going to receive is much greater than if, once they're done and they see the pigmentation issues and we're like, oh, well, this was just part of it. But if we prepare them for that, then they are more likely to accept it.
Yeah, and I think that's important that the listeners know that we're not aiming for that, but in some treatments if it's a significant acne scarring, for instance, and we're going to have to be rather aggressive with some of the treatments, then we're going to do everything we can to minimize this inflammatory process and to mitigate those risks. But that also we can treat PIH. We do have devices and ways to treat it, so I think that's a really good point to make. Is that what you were looking for,
Yeah.
Allie? Yeah. And you can get PIH, I think, when we talk about post-inflammatory hyperpigmentation, a lot of our patients will know what this is, because they're going to remember having an inflamed spot from acne that maybe they squeeze too aggressively. So we say, don't squeeze it, don't pop that pimple, because when you do those things, it gets really inflamed, and then you end up with a dark spot there that lasts for a long time. And so that's, one of the things that we can recognize from doing it individually, but also we can see with our aggressive laser treatments. Yeah, thanks for those tips, and I hope you guys have learned a lot throughout this podcast. One of the things that really is truly reflective of Jerry and myself at our core is included in our mission, vision, and value statement. Mm-hmm. We don't think about it a lot, but we have a business plan, and in that has a mission, vision, and value statement. And it really is what we stand for at our core, and it is what we want represented in our business. And part of that value statement, I'm just going to read it. It says, at Skin Tonic, our values are at the core of everything we do. We're committed to number 1, safety, number 2, education, number 3, honesty, number 4, integrity, and number 5, a culturally diverse practice. So we picked 5 things, and in that top 5, we picked a culturally diverse practice, and we expanded on that a little bit and said we're committed to providing a welcoming and inclusive environment for all of our clients, regardless of their background or ethnicity. We celebrate diversity, and we believe that it enriches our practice. And that is truly reflective of Jerry and I at our core beliefs, and I know everybody that works with us, Allie, Sierra, Lindsay. And so not only do we want everyone to be comfortable, we want to be educated and able to provide safe treatments for everybody that walks through our doors.
Yeah, I love our mission statement.
Yeah, it took us a minute to get it, but yeah, and thank you, Sierra.
Us. I mean, it's how I think it's how we live our life. Mm-hmm.
So we've talked about a lot of things in this episode. So Jerry, I think that all of us should give tips to providers and patients before we go. So we'll start with you.
I think one of my tips to patient would be to be sure, and provider would be to be certain to follow the pre-treatment protocols, because a lot of times those, it may be viewed as something that's not important, but oftentimes we'll put them on a treatment plan to lighten skin prior to some of these treatments. And that does go into play to help to minimize any hypopigmentation, hyperpigmentation, and to optimize results. And I also think that post-care treatment is equally as important, as if not as important as the treatment itself, because inappropriate post-care can actually cause a really good treatment to go south. So be sure to follow the instruction provided to you by your healthcare provider, your esthetician or physician or nurse practitioner, and because everything we're doing is trying to make a better you.
For me, I think one of the things right now, peptides are a hot topic. Lots of people are on peptides for a million reasons, from weight loss to improved muscle growth, increased sexual performance. But one of the things that we know is out there and people are using a lot is one for tanning. And so they're using the melanotan to make their skin darker. And so you really need to be aware if your patient is on this, because it can, and if you're a provider, you need to be aware. If you're a patient, you need to be aware to tell your provider, because it changes the way that your melanocytes are secreting melanin, which is going to make you respond differently to a lot of these energy-based treatments that you can receive, as well as some of the topicals, the chemical peels and stuff. So you really need to share that with them.
And I think my tip would be for providers, anytime you're treating a patient, make sure and ask the question about self-tanner. Self-tanner is big, especially as we discourage tanning beds and tanning in the sun to prevent skin cancer and have healthier, youthful skin. A lot of people, myself included, use a lot of self-tanner to be darker. And so whenever you're treating somebody that is using a self-tanning product, you do have to treat them at the Fitzpatrick they currently are because of the self-tanner, not what they are normally. So if somebody is normally a Fitzpatrick 2 and they're lighter, but they've been using self-tanner now for a week every single night and baking in it and not showering, and now they're a 4, you have to treat them as a 4, because these lasers are not smart enough to say, oh, that's self-tanner. They're treating the pigment that the laser sees.
Thanks again for tuning in for another episode of Beauty in the Brain. I hope this episode was informational for you guys. If you want more information about the treatments that we offer for all of our patients, Fitzpatrick's 1 through 6, go check us out at skinandtonic.pro or come in for a consultation with one of our providers.
See you soon.
Thanks, guys.